Middle Tennessee. This is my first time to the TFA conference. I'm delighted to be co-presenting with Erin Bradley, and so glad that you're here today. We are going to talk about advocacy work that is going on in the state, led by the Tennessee Coalition for Better Aging. We want to invite you to be part of that process and really want to present to you for the first half hour of our session and then open up for conversation. We want to hear what you're seeing in the community. We want your ideas. And so I really want this to be an interactive presentation. Just a quick note. So I run a nonprofit in Middle Tennessee. We used to be the Council on Aging of Middle Tennessee. We're now Age Well Middle Tennessee. And in that role, we are a trusted community resource. We publish a directory of services for older adults in Middle Tennessee. We also are a catalyst for solutions to unmet needs and an advocate for older adults and family caregivers. So that's a little bit about my nonprofit role. In that role, I have the pleasure of currently co-chairing the Tennessee Coalition for Better Aging with Dr. Jim Powers at Vanderbilt. Our secretary is Donna DeStefano with the Tennessee Disability Coalition, and the Tennessee Coalition for Better Aging is truly a coalition with a number of organizations across the state who have realized we're stronger together. We're stronger when we combine our voices, when we identify priorities together, and we reach out to state leaders about changes that are needed and improvements that can be made. So that is really what we're here to talk about today. And the purpose of our presentation is to increase awareness of innovations in other states when it comes to long-term services and supports, and the advocacy work we've been doing is part of a campaign called Reimaging LTSS in Tennessee. I want to share with you the guiding principles that have come out of a series of virtual meetings with stakeholder involvement, and some of the priority recommendations that have come from these meetings hosted by the coalition. And then lastly, talk about opportunities for collective advocacy, for working together to elevate the voices of older adults and caregivers across the state, and to get the attention of state leaders about improvements that we need to make to build a stronger system of support, our long-term services and supports. The first half of our presentation will be sharing with you the work of the coalition, some of the innovations in other states, and the recommendations that have come out of the virtual meetings. Then we're going to open it up for conversation. Before I get started talking about the coalition's virtual meetings, I wanted to share some of the organizations that were part of our steering committee in planning those meetings. Mental Health America of the Mid-South, American Senior Care Centers, I see Bill Zagorski here, the Tennessee Disability Coalition, Tennessee Justice Center, and the West End Home Foundation. Just to name a few. There have been many people involved. Erin was part of our kickoff webinar in March that I'll talk about in a few minutes. And we had Steve Joyner with Lipscomb University facilitate those conversations. One of the things that we really feel is important when we talk about long-term services and supports is to frame it as a continuum of care, a continuum of services. Everything from home-based care to community-based care to facility-based care. We need it all. We need a continuum as we age to serve a variety of individuals and different levels of ability and disability. So I want us to keep that in mind as we talk about reimagining long-term services and supports. When the Tennessee Coalition for Better Aging started talking back at the beginning of the COVID pandemic about what issues are most important to the organizations. Home and community-based services keeps bubbling to the top, and it's been that way for several years. But what we found during the COVID-19 pandemic is that it has really amplified the shortcomings of our systems. and the needs we have, the needs that families have across the state, is they take care of aging loved ones. And so the coalition realized that we had an opportunity to organize a series of meetings to bring people together across the state, stakeholders, people from different sectors, public, private, government, nonprofit, philanthropy, to talk about our long-term services and support system and where there are shortcomings, where there are opportunities to make improvements. As a social worker, as a nonprofit leader, as a daughter of aging parents, I am really concerned about where we are as a state. I'm concerned about the calls we get when people can't afford to pay for services they need and there are waiting list for services, or we don't have enough direct care workers to meet the need. We have a lot of issues that need to be addressed in our state, which has precipitated these conversations. I'm pleased to say that in organizing the series of meetings earlier this year, we were able to engage over 100 stakeholders from across the state. And that included all the sectors I mentioned before, but also older adults, family caregivers, and adults with disabilities. Again, coming together to learn about what other states are doing and to talk about what we can do here in Tennessee. Our first meeting was in March of this year. Did any of you participate in that webinar? I'm curious. A few folks here. Okay, very good. That was really our kickoff conversation to learn about national and state trends in innovating long-term services and supports. There are a number of states that are way ahead of us in looking at this, and we felt like it was important to take a look at what they're doing and learn from that, as well as talk about what we need in Tennessee. We reviewed what Tennessee's system looks like, and we also reviewed some of the recommendations that came out of the 2017 Comptroller's report, namely that we need to expand home and community-based services, develop and invest in the direct care workforce, and further develop a comprehensive and coordinated system of services. All of those recommendations are absolutely still relevant today. The urgency has just increased. So what I want to talk to you about is what were some of the innovations that we learned about in that first meeting. We were fortunate to work with Mark Cohen, who is a leader at the Leading Age Long-Term Services and Support Center at the University of Massachusetts, Boston. Mark has studied what other states are doing to innovate primarily how they finance long-term services and supports. And he told us that the main drivers for states looking at this are increasing pressure on state Medicaid budgets, the need to improve support for family caregivers, and the need to support the broader middle class. There are a lot of people out there in the broader middle class who cannot afford to pay for an extended period of time for the care they need or their aging parents need. And that's a real concern that's getting the attention of states. I was shocked when Mark shared with us that the average retirement savings of an individual in our country is $10,000. Also, fewer than 7% have long-term care insurance. That is a recipe for disaster, and it just underscores the need to start looking at how we can come alongside families and help them and come alongside older adults so they can age with dignity in our state. In our current system, it's really fragmented. Most end up paying out of pocket for long-term care costs and then having to spend down in order to qualify for Medicaid when their needs grow. We also have limited capacity to serve. State funding has not kept up with the need, and so we have waiting lists, and we definitely have a direct care workforce crisis on our hands. So what we need to do is what other states are doing is look at engaging multiple sectors in this conversation. And Minnesota is a very interesting example. It's the one we looked at. They consistently rank number one on the long-term services and support scorecard that AARP does. They are looking at that broad middle class, and they're looking at private market solutions that can be brought to the table, particularly hybrid insurance, where you have insurance that starts off as life insurance but converts to long-term care insurance. They're also looking at adding home and community-based services to Medicare supplement plans. So again, what are some of the private market solutions that can help meet the need? That's something we're learning from Minnesota. In Hawaii, they have created a weekly benefit allowance paid to home and community-based service providers. The limitation they're finding is that it is state funded, and if the state dollars aren't there, there's definitely a limit to how many can be served. Mm-hmm. It is, so it could be in-home care providers that are through organizations that provide in-home care. I'm not sure if Hawaii's system is paying family caregivers directly or not. That may be available through Mark's report, and I'm happy to share that with you, his report on other state initiatives. I don't have that level of detail yet on Hawaii specifically. In Washington, that sounds like a good location, right? Oh, wonderful. Good. Excellent. Thank you, Bill. I'm glad you're here. Chime in anytime. Uh, Washington State has been innovative. They are actually the first state to create a social insurance program where they passed a 0.5% increase in the payroll tax in order to fund this. And what it does is when you're working in the state of Washington and you are vested in this program, you can eventually receive up to $100 a day to pay for long-term care services for yourself or a spouse or an aging parent, up to a lifetime maximum of $36,500. So that was a coalition-driven effort that was successful in Washington State. Certainly something to keep in mind, although tax increase would certainly be difficult to advance in Tennessee, and that's something we've talked about. In our first meeting, after we looked at what other states are doing, we wanted to hear from everyone that joined in that webinar. What are the principles that are important to you as we talk about reimagining long-term services and supports? And we used a word cloud exercise to ask participants to type in up to 5 principles or words or phrases that showed what is really important to them. And you can see, some of you may have done a word cloud before. It's really a fun exercise. The larger the word, the more people entered that same word or idea. So you can see from this: caregiver support, affordability, choice, independence, community, accessibility. Those were a number of people had those same ideas about what should be our guiding principles as we move forward. So fast forward to our April meeting, we took the ideas from the word cloud and we divided our group into groups and said, okay, let's take some of these key concepts, and these were the 6 areas that we felt like really emerged from that word cloud exercise. Let's take these 6 areas and have teams work on a guiding principle statement. So you can see personal choice and self-determination, affordability, caregiver and family support, community and home-based care, accessible, equitable, and inclusive services, and quality of life and and services. That second meeting was a working meeting to really flesh out what is it that we need to say is a guiding principle for this effort. And we came up with those guiding principles. I've printed a few copies today, and I'm happy to share that with any of you who are interested. I think it's really a robust framework to lead our effort and lead our conversations, because certainly all of these areas are really important as we move forward with planning. Our third virtual meeting was held in May, and what we wanted to do was to take the guiding principles that had been developed and talk about strategies and priority solutions that could be rooted in those principles. We used breakout groups and organized them around the 4 areas that you see: government and policy solutions, public-private innovations and opportunities, strengthening our systems of care, and building awareness and catalyzing action. I'll get into some of the recommendations, specific recommendations, in a little bit. But prior to that meeting, these were some of the ideas that had been mentioned from our first 2 meetings that the participants were most interested in. We had learned in our webinar about the Governor of California issuing an executive order that prioritized long-term services and supports, prioritized older adults and caregivers in the state, and a number of people said we should have the governor do something like that here. We also heard from participants we need to expand Medicaid coverage and particularly open up the 10 Care Choices Group 3. We need to go upstream to people who are at risk for needing nursing home level care. Let's keep them at home as long as possible. Stakeholders said we need to increase pay for direct care workers. We need to pay them, we need to value them to attract and retain those workers. And we also need to improve the reimbursement levels for the providers who are paying those workers so that they are able to attract and maintain the workforce they need. Participants also said we need additional funding, support, and training for family caregivers. We know families are shouldering the majority of caregiving for older adults and adults with disabilities. We need to come alongside and support them and equip them to do that. And there was also interest in creating a stronger no wrong door coordinated system of care. So no matter where an older adult or a family caregiver calls, they're going to get connected with the services they need, and they're going to get consistent information as well. So that was another idea that emerged. I'm going to invite Aaron to come up now and share with you why this is so important and then some of his perspective.
It's morning, right? Good morning, everyone. The answer to long-term support services in the state of Tennessee is in this room. And the voices we need are in this room. And it's time for action. I told Grace, thank you so much for inviting me to be a part of this. Thank you for putting together this PowerPoint presentation. Thank you for doing all this work, and I just show up and get to talk a little bit. There are a lot of innovation we're seeing in Washington, Minnesota, many other places. Unfortunately, most of those places are not from around here. So when you talk to legislators, they're going to remind you immediately, I need a solution that's a little closer to home. And there are solutions in our region. But we've also been fairly successful over the years getting them to look beyond the region. But we have to, at the end of the day, come up with a Tennessee solution that fits the dynamics that are our reality here. We all know the population is growing exponentially. We know the fastest. You're supposed to be helping me, Glenn. This is an opportunity for me to take a swing of a bad habit. You know immediately this is not a nutrition workshop. fun in life, life's worth zero. But when I say to you, the answer is in this room, it is in this room. Don't underestimate the value of your voice as an individual. Someone said many, many years ago, if you think one person can't make a difference, think about the mosquito in your life in the summertime. One mosquito can make your life miserable. I'm not suggesting you make legislators' lives miserable, but what I would like to say to you is this is an educational process. Grace and the leadership within the coalition have moved us along well in the last year. But I sat over there by my good friend who knocked me out of my chair when she came, Marie. Much of what you said we heard 20 years ago. It's as relevant, more relevant today, because we're in the midst of a long-term support crisis in this state. If you look at the data, and you look at the population, and you look at the fastest growing segment of our population being over age 80, and you look at those challenges functionally, what label might you put on that? I would put a label of perfect storm. We're in the midst. We're not looking for the storm. We're in the midst of a perfect storm. So part of what drives me every day is telling people that I come in contact with, if you don't get busy and plan in a hurry, you're going to be spending more money than you ever thought imaginable. Because in our state, like most states, nursing home care is an entitlement. So the goal is to keep folks in the community, support family caregivers, create innovation and options, because I believe the Medicaid reimbursement rate right now for nursing home in Tennessee is about $78,000 a year. Now, in my book, that's a whole lot of money. Choices Part 3 went away, and many of us who work in that network felt like that was a move in the wrong direction, so I'm glad the coalition is looking to bring Part 3 back. But what we have to do, I told you I'd be off script. The governor's task force, when Haslam was the governor, provided some good foundational information. Several years ago, I went over and met with our good friends in the comptroller's office, Jason Power, and his research team, and I said, hey, what about dusting off that long-term support study you did? They were kind enough to do that. They issued that in September, I think, of last year. If you haven't read it, read it. It's got some good stuff in it. Grace has already talked about that. They understand from a financial standpoint. You know, the comptroller office works for the legislature. It's not part of the executive branch. So it's looking out for the interest of the General Assembly, right? So they're looking at these costs and they're thinking, if we don't put a system together in short order, our Medicaid budget is just going to continue to grow and continue to grow and continue to grow. The problem is, if we make decisions about long-term support just thinking about Medicaid, that's a mistake. Because Grace said it very well. There's a huge middle class that we have to look at trying to create an opportunity for so they can pay most of their own way. Innovation in other states creates a model, maybe using Medicaid, but it's a model that's much broader than Medicaid. I'll give you an example. In the state of Oregon 30 years ago, they created what they called foster care homes. Now, I wouldn't call it that in Tennessee because that sounds like children, right? But they were small supportive group homes for this population we're talking about, primarily aging and persons with physical disabilities. Tennessee already has this solution for the DIDD population and for the mental health population. Neither system is perfect, but it is a small residential alternative. Why do we not have that alternative in Tennessee for older adults and persons with disabilities, physical disabilities? Several reasons. One is funding, but the nursing home industry, any nursing home administrators here? I'd say it anyway. I just wanted to know who I was about to offend. We need nursing homes in Tennessee, no question. We have families that have to have that level of support. I support nursing homes. I don't support nursing homes at the exclusion of quality, community-based alternatives. That's the only difference for me. So the bottom line is, you have to look at how we're spending and balancing the long-term care system. So Oregon, 30 years ago, first time I brought this up with legislators 20 years ago in Nashville, they reminded me what I said a few minutes ago. Oregon ain't from around here. But there was a delegation that actually went out there to take a look at what they were doing. So 30 years ago, to stay out of the nursing home or to transition out of the nursing home, they created the foster care homes. What that did was create a partnership between Medicaid, families, caregivers, and private funding. A short 10 years into that model, would anybody wager a guess? Because when they created the model, they didn't quite understand that it was going to have appeal beyond Medicaid recipients. They figured that out after a few years because they started getting calls from families saying, Mom has only $1,500 a month in income, or $1,000 a month. She can't live alone and I work. What are we going to do? And they said, well, we got these group homes that we're funding with Medicaid, but I don't know why you couldn't have your mom go to one of these group homes for $1,000 or $1,200 a month. So a trend started. 10 years into this model, what percentage do you think was private pay versus Medicaid? In hundreds of group homes, there are 1,800 group homes in Oregon today. Anyone want to wager a percentage how much was private pay? Close. 2/3. 67% private pay. Medicaid in Oregon hit on something that they were putting together for a very different reason. But they hit on something that hit a sweet spot in Oregon for families who needed long-term support. They now have, now don't tell this outside this room, especially to your colleagues. TCAD's staffing a task force on what to do with unlicensed group homes in Tennessee. And months ago, as carefully as I could, I said, you cannot close your way out of this problem. And it would be morally corrupt if you tried. Because guess what? Folks who wind up in unlicensed group homes have reached the end of their rope. They have no other alternative. They have $800 or $1,000, maybe if they're lucky. They have no social or family support, and they can't live alone. And a lot of times they've messed up their ability to rent because they've been evicted or what have you. That's the population that's in group homes in Tennessee today. We were lucky enough in East Tennessee, and I'm looking at some of my colleagues in East Tennessee. We were lucky enough for East Tennessee to come up on the radar screen earlier this year with an unlicensed group home or two or three in Hamlin County. In a period of 2 months, CREVA staff, area agency staff, APS, lots of people, helped 30 people transition from 3 group homes to other locations. Some of them went to the hospital. Guess where some of those hospital discharges put people? In different unlicensed group homes. Because there's just no alternative. So pretty early in that process, folks realized, oh my gosh, does that mean I got 30 minutes? Not near enough time. Okay. But you came in this room to learn a little bit, many of you already know this, but learn a little about what can I do and what can we do to make the system in Tennessee better, right? If you look at the continuum of care, Grace mentioned this a while ago, you've got the end of that continuum. Glenn told me I would do this, and I just did it. I walked away from the microphone. You've got the continuum of care, and you've got nursing homes on one end, independent living on the other. You back off nursing homes, and you've got assisted living. You back off of that, and you have HCBS, adult daycare, many other things. You back off of that, and you fall off a cliff until you get to independent living, because the state of Tennessee has no answer. It's as simple as that. 25 years ago, we started this discussion in Tennessee. And when I talk about it, I get emotional about it, but I also get angry. Because 20 years ago, we had an opportunity to do the Oregon model, and I refer to it as the Tennessee model. That's ingenious, right? I mean, I said, it's not the Oregon model. It'll be the Tennessee model, because it'll be different for our state. But you've got that gap in the continuum. And you talk about middle class failure. The state of Tennessee has failed in 20 years to come up with an answer for the increase in population and for the folks who don't have the social fabric or the family fabric to take care of them in old age. Not to mention the money. So we have these more poor individuals who are frail, who are finding a solution on their own, and often it leads to what? Abuse. Neglect, abuse, financial exploitation. And I have said for the last 6, 7, 8 months on this task force, and mostly behind the scenes with people on the task force, we have to figure out a way to help those who are pretty good become better and get them a certificate or a license, right? And we need to slam the doors on the bad ones. But guess what? When you slam the door on the bad ones, you have 5, 6, 8, 10 people that you have their lives in your hands. And as a state of Tennessee, we better smarten up, wise up, do the right thing by these folks. The focus in any challenge like this is almost always on the unscrupulous operator. We're going to nail that person to the wall with whatever means necessary. I get that. I mean, I get it. But you can't lose sight of what the impact of closing a group home is on the people there. I'm not suggesting that we allow bad care or abuse or financial exploitation for 1 minute. But we have to go in with our eyes wide open. And that's why I think we have to, when we talk to groups about long-term support change, we have to look at innovation, private sector solutions, insurance, help folks early in their risk, catch folks before they get in a crisis. What I've learned doing this job is that when you manage services in a crisis, you do 2 very bad things. We do 2 very bad things. We affect the quality of life of the individual we're trying to help, and we spend a heck of a lot more money than we would have if we just did something ahead of time. So that's what we're talking about, I think, today. Look at other states, see what's wrong, look at our gap in the continuum, and try to figure out a way to come up with a solution like Oregon and others have done. Most folks who retire or reach retirement age, they have between $800 and $1,500 in income. That's where our planning needs to be, right? Now, as a bureaucrat, and I use that loosely when I'm trying to go after somebody, you're just a bureaucrat. Well, I'm kind of one too. But isn't it better to support folks with a little bit of public money than a whole lot of public money? $78,000 a year is a lot. So if we don't get this figured out, if we don't get that continuum built up, then what we're going to have is way more people in that $78,000 place. And I'm afraid policy folks in Nashville are going to think they did an okay job because they have Medicaid to shore up those folks who are in greatest need. We have to stop looking at that end of the spectrum. We got that base covered. And every solution in Tennessee can't be just Medicaid. We have to start thinking about the private pay. And I think what you all discovered in these listening sessions, folks are saying, what about me? That's what they say to me when they call me and call you on the phone. What about me? I have $4,000 in the bank. It's my life savings. They told me that I was going to have to spend half of that or more. And then they told me I had a piece of property that's been in the families for 70 years, and I'm going to have to sell that. And I've got a little life insurance policy that has a cash value. You know where this is going, right? And it's like, I'm not going to do that, or I don't think I should have to do that. And what we're forcing folks into is the highest cost of long-term care in our state. Let them keep their $4,000, $10,000, $25,000, $100,000. As long as I'm partnering with them and I'm not paying the full cost. They got $100,000 in the bank. I force them into Medicaid. I spend almost that much in Medicaid dollars the first year. We have to get people to think differently about this. I think we have folks in the General Assembly that would look at this today as a business model, as an investment. They'll have to move a little, because if you're that person who thinks everybody ought to take care of themselves or their families, well, number one, you're not living in the real world, but you've got to figure out a way to help these folks who are in that income, right? So I would hope that 5 years from now, when we come back together, that everybody in this room, including the folks on the Coalition and Grace, could look at each other and say, we did it. We helped the state of Tennessee figure out a way to build out that continuum that don't exist today, except in unlicensed programs. The Comptroller's Office issued the report right in September. It's all I can do sometimes to get a legislator to spend a few minutes looking at it. So if you know a legislator, get them to dust off that report, because it says to the General Assembly, what we're doing is not sustainable. The biggest message in the report that's almost not said is what we have today is not sustainable. And then you look at the Let me just say this in wrapping up, because we want to leave plenty of time for you all to talk. If you agree that we've got the high end of long-term care taken care of under Medicaid, not the best solution, but that's out there and it's funded, what can we do individually and collectively to build out the supportive residential piece that we're talking about? Because that's what it's going to take. Whether we license group homes or we provide a certificate, I don't care what we call it. We just need to do it, because it provides monitoring, oversight, standards, etc., etc. And it won't be horribly expensive. In Oregon today, 30 years later, now don't say this, please don't say this to your legislators, because it'll freak them out, and it'll get the nursing home industry and some other folks really revved up, but you need to know it. What happened in Oregon after 10 years, they started looking at, well, we can't serve everybody that needs help in this model at level one. Level one was meals, safe place to sleep, some activities, transportation, and maybe help with managing your medication. So in the last 20 years, they now have 4 levels of homes in Oregon. Anybody want to wager a guess? And you may know because you're shaking your head. Level 4 in Oregon today is ventilator patients in the community, in a private home, staffed exclusively by nurses. at about 40% of what it costs to keep someone in a facility. But they're in a home environment. They're around their new family, and they're not in an institution. And you believe the nursing home industry might oppose that? So you don't want to start with level 4, you don't want to start with level 3, which is not ventilator patients, but folks who would really be what we would refer to as being in a nursing home today. And I'm not suggesting Tennessee would ever get to that place, but I'm suggesting to you that that's possible. You talk to folks every day, we talk to folks every day that absolutely depend on us to do better. We're in a crisis. We have thousands of our neighbors in group homes in the state of Tennessee with no state oversight and no state financial support. And I would submit to you that when I talk to a legislator, I'm going to talk about an investment in trying to make sure we don't run out of money as a state. Because if our only solution is $78,000 a year, as the comptroller said, that is not sustainable. I appreciate it.
Thank you, Aaron. And I love the word investment. That's actually the word that keeps coming up for us, investing in the direct care workforce, investing in family caregivers, investing in our system. I want to take just a minute to go through some of the recommendations that came out of our third meeting, just to spur some thinking, and then we want to open it up for your feedback about ideas, solutions, and even where you see the biggest gaps in our system. Coming out of our third virtual meeting, I had mentioned the idea of the executive order. There was support for that, even just in getting the governor's attention and having him come out and declare that older adults with disabilities, and family caregivers are a priority in Tennessee. Another recommendation was to develop specific recommendations for the American Rescue Plan Act, the $157 million that TennCare has applied for specifically for home and community-based services. We did that as a coalition, emphasizing the need to deal with the direct care workforce crisis, provide more support to family caregivers, and expand Choices Group 3. Again, go upstream. Let's look at preventive care, supporting people at home for longer periods of time. I'm pleased to say that TennCare did consider those recommendations along with input from a lot of other organizations, and that we did see glimpses of those recommendations in their plan for the $157 million. That federal money is a great opportunity to start this conversation, to make some investments, but we need sustainable solutions. I mentioned the direct care workforce. That bubbled up in our third meeting as such a critical issue that we have to address. And I'm sure you all are well aware of that, the need to reimburse providers more and to pay the direct care workers more, and give them training, give them a career ladder so they stay in the field and they see a future in it. Enhanced support for family caregivers was also an area. One of the specific recommendations was expand the DIDD Family Support Program, which basically provides flexible financial support for family caregivers to use as they choose. Let's expand that to other groups of family caregivers. Invest in respite care and adult day programs. Provide additional assistive devices and equipment to family caregivers. Invest in home and community-based services to delay or avoid the need for nursing home care. Aaron spoke of that, and that certainly is an area where we have opportunity. And then strengthen our system's capacity. One of the things that we talked about was creating a person-centered advocate network, which is something they've done in the state of Virginia to come alongside people and really help them plan for what they want, give them choice, and help them figure out how to make that happen. Aaron has talked about what Oregon did with the small residential group homes, and certainly that's an opportunity for us here in Tennessee. We have to think about what's politically feasible here in Tennessee, and we really have to avoid any positioning ourselves in any way that we are opposing nursing homes. This needs to be a both-and conversation. It needs to be about needing a full continuum, and we don't want nursing homes opposing anything. We've seen already in the state of Maine, they overemphasize home and community-based services, saying they're better than nursing homes, and guess what happened? They failed. So this has to be a both-and conversation, looking at a full continuum. Okay, here we are. We have a little bit of time left. We want to hear what you think about solutions, where you are seeing the biggest needs, and would really love your help identifying family caregivers and older adults willing to share their stories. We need to have people willing to be interviewed, to have stories in the media. We need people willing to share their stories with state legislators, because that is what is going to move the needle in this effort. So I want to open up the floor and hear from you.
So, yeah, the guy sitting next to me, you know, we have been working together a very long time. He's older than me, but, so, like you said, 25 years ago, you know, we used to say, or my friend Gordon Bonnyman used to say, nursing home, or long-term care in Tennessee came in 3 flavors. Vanilla, 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 because it was nursing home, okay? That's what we had. And through Voices, we got the Choices program. And it finally happened. And I honestly wasn't sure if I would see that in my lifetime in this state. So, hallelujah, we have it. We have a program. And as Aaron is aware and mentioned, we have now family, you know, we have adult foster care through the Choices program. We have CLS homes through the Choices program. You know, we have some reimbursement in Group 2 for assisted living. But it's all tied to Medicaid. So we all get those calls, you know, well, I've worked my whole life for this $10, $20, $30, $40,000, and now I'm going to have to spend it all down. And the brilliant thing that I hear being talked about today is present this as a business model.
Yes.
Present it as an opportunity to say, yeah, we've got this system, this Medicaid Choices system, yay, look at it, you know, look at what we've got in this continuum of care. But if we offer a private pay option as part of that, then we're going to be able to reach all of these folks that still have some assets, may not medically meet the guidelines, since we know the whole PAE process is like going through a ring of fire to get approved.
Preach it, honey.
And so, you know, we're not fighting all that. Did you score a 9? Oh, you scored a 5. Okay, well, let's try a safety. Let's do this. Let's do that. It's crazy. So, business model involving, you know, private business, getting insurance companies involved to provide, to sell a product that might provide, you know, coverage. That's brilliant. That's brilliant. And so the whole concept of present this as a business model, not an expansion of the Medicaid program, because Lord knows those are not words you want to use in this state. But, you know, absolutely present it as a new opportunity for a public-private partnership business model.
Grace, just chiming in, so it very much is a viable business model. Someone that owns a private organization as well as, you know, works for the statewide nonprofit organization, it's very clearly a viable business model for public-private partnerships. One of the recent examples of that, you mentioned Minnesota, just 2 weeks ago, one of the larger Medicare or managed care organizations purchased a statewide home community-based service provider providing home care, home health, adult day, and it just entered into the adult foster. So now they are offering it for all of their Medicare Advantage plans as part of the supplemental benefit. So not only are small private organizations, but larger managed organizations are diving into the fray. It happens in Minnesota, it can happen in Tennessee.
Tennessee model.
Yes, we just have to call it Tennessee. Yeah, thanks, Phil.
There are models out there that we can adapt. We don't have to start with, try to invent something from scratch. So that's what we need to look at, and thank you for that example.
Yeah, just comment on a couple of things. 25 years ago, the intellectual disabilities community created a academic program for direct care professionals at a community college level, and then created some tiered salaried stuff with it, and it worked. It worked for a while, as long as people wanted to fund it, and then people decided not to fund it anymore, but it was very beneficial to the system and of course to the people who participated in it. And so that's really an idea that's happened here in Tennessee before and could be used. Additionally, I would just say that we have reached a point where we really are at a breaking point, because the nursing home system can no longer accommodate the number of people who are Medicaid eligible for nursing home assistance. Like there are just no nursing homes there are not enough beds in nursing homes that will accept Medicaid payments. So not only have we relied on that system for a long time, probably inappropriately, but now that system is no longer available in many geographic areas to people. So like that system is not available anymore either.
The capacity is not
The
there,
capacity
even within
isn't
the
there.
system.
Right, and frankly, they will, because it is so economically poorly funded, they won't expand Medicaid beds. They literally are closing Medicaid beds. So the truth is, although it'd be very expensive, if it were available, it's not adequate either, and it's just not available in many areas. So we have reached ground zero with that system as well.
That's an excellent point. We're hearing similar things from the home care industry about the fact that providers are just saying we can't continue to provide services to the choices population for the reimbursement rates that we're receiving.
That's correct.
We just can't do it.
And I would say that my experience is that that's not available either.
Well, we're actually hearing about 150 people who are eligible for Choices Group 2 every month are not being served.
It's correct.
And the number is just growing exponentially month to month. What we see at the area agency level is something very similar. And 5 years ago, we said publicly, the home care network in Tennessee is in crisis. Fell on deaf ears year 5, fell on deaf ears 4.
Yes.
Now we're post-pandemic or mid number 2 pandemic, and most providers tell me they've lost at least 25% of their employees in the last 2 years. Now, if you look at this industry, you understand that even this is true in nursing homes. The majority of direct care workers in our state and every state are women. The majority of that group are above age 50. This is not a young person's profession, and the people who have been in it are getting out of it. They're retiring out or they're leaving because of COVID. So the system is in a desperate place. We have providers that tell us every day, because we use the same providers the MCOs use, right? Because the area agencies recruited those providers 20 odd years ago for the initial HCBS waiver under Medicaid, those same providers, many of them are still in the system. When Choices passed, the MCOs came in as the network payers. They use the same system. So we're all using the same providers. And we're getting the same response that Medicaid is paying. I mean, Medicaid is getting on the MCOs. We cannot open a new case. We can't even serve the folks that are currently authorized for service. In one area agency, East Tennessee, last year, 2020, we had over $400,000 in unpaid services, meaning the providers couldn't meet the authorized threshold. Now, in a $3 million operation, $400,000 is huge. So you know the system's on its knees. These folks are not turning down cases, are not staffing existing cases because they want to. They simply don't have the workers. And no one seems to be interested in spending more than 5 minutes talking about that beyond this room. And I stand on the street corner, like many of you do, almost weekly, saying to people in Nashville, you don't just have a medical care crisis in Tennessee, you have a non-medical care crisis in Tennessee, and at least give it equal attention, right? And the rates right now for homemaker and personal care is about $20 an hour. The private pay rate in our state's 25 plus. The VA has stepped into our state in a big way in the last few years. Guess what their reimbursement rate is? 27. You can go to work at Chick-fil-A for $15 an hour.
Right.
You go to work in a home care agency, you're lucky to get $12.50 an hour. And $12.50 is up $2 from 2 years ago. So it's like, Grace, we're all in this work, and we're in the midst of the crisis, and we've got to get folks to look at solutions beyond Medicaid, right?
Yes,
So
absolutely.
when you put that information out there, folks go, OMG, you know, they see it the way we see it. But we've got to just keep talking that up at every level. Because it don't matter how much language I've got in the contract that says, if you don't provide this service, I'm going to get after you contractually. You know, what I can't do today in the marketplace, I really can't put pressure on a provider unless I want to lose them. If I can get 75% out of them, I'm a happy camper. Right?
Right.
And the MCOs are not telling this story. Because they don't want anybody to know that they have hundreds and hundreds and hundreds of choices clients they cannot serve. But that's where we are. You mentioned it. I mean, it's insane. Right?
And this is why we have to raise awareness. We have to have stories in the media. We have to be engaging with legislators, making sure they know this and presenting it as a business model.
Let me say this to you,
yeah.
if you don't mind. Many of you, do y'all know what the Katie Beckett waiver is? I watched this happen firsthand when families visited the legislature with their loved ones. I remember a gentleman walking in the halls of the General Assembly carrying his daughter. He had taken her out of her mobility device, and he was carrying her, and he carried her into the committee room where they were discussing the possibility of the Katie Beckett waiver. I had all the compassion, empathy I could muster for that man and his family. And if I'd had a vote, I'd have voted with both hands. We need to help these families. Do you know what that dynamic represents? Exactly what we're talking about. Because what the legislature did was instruct TennCare to apply for a waiver to help these families so that they could keep their money in play and get some extra help under Medicaid for that daughter. Katie Beckett. We could do the same thing with the older population. I'm not suggesting that we take a lot of older folks who are frail into the General Assembly, but I'm not opposed to it. I mean, I'll just say that out loud. If we don't get to that place, we will not get the change that we need. High up folks at TennCare have said to me in the last year, if we can do the Katie Beckett waiver, why can't we do one for older Tennesseans?
And we can remind legislators that older adults show up at the polls
We can't.
in high numbers. You know, let's not forget that too, the power of that. But to your point, Aaron, people's stories or constituent stories,
Oh.
those individual meetings are gonna make a difference. These are our neighbors, our parents, our families, ourselves. And that's what we need to make it about we and us, not them. You know, we're trying to help them over there. No, this is your family, it's my family, it's all of us as we age in Tennessee. And that will help change the conversation. One thing that we shared with James Dunn recently, the new executive director at TCAD, was that between 2 and 3 million women have left the workforce during the pandemic because of caregiving. Now, that's a combination of child care and elder care, but that's a staggering number. And his reaction was, oh my gosh, we need to be talking to the chambers of commerce. This has become a labor workforce issue when you start talking about women. 61% of caregivers are women and they're working. So, it's those types of that type of framing that will get attention and broaden this conversation. We would love for you to be part of this effort. You can go to the Tennessee Coalition for Better Aging. We have under the Take Action tab, there is more information about this campaign, and there's a simple form you can sign up to receive information about it, to say you're willing to share your story, or to reach out to state leaders. We'd love to have you involved. We need your voices. And as Erin said so well, the answers are in this room. You're seeing it day to day, and we can do this, but it's going to take all of us working together. So thank you all for being here today.
You guys, please remember to fill out